Great. So for those that have just logged in, wonderful. Those are just logged in. We're just going to wait a few minutes here as you are starting to log into the Health and our Watershed Boundary Region presentation, the RDKB Watershed webinar. And as you can see at the top of that, your screen there, in the chat box, introduce yourself and tell us the name of that watershed you live in. Or maybe you would rather tell us the name of your favorite watershed. So just letting us know, yeah, where you're calling in from. Just gonna give a few more minutes here as we're seeing some more people signing in at the moment. Morning, Rachel. Hi, Kathy. Oh, great. We've got CL logged in. Let's give it another minute. Thanks very much, everybody. All right. Hi, Jade. It's been neat. One of the neat parts about the webinar program is the registrant. So I get to see some of the names of and some of the areas where people are calling in from or signing on from. So it's been pretty great for me. So I would say let's start her up. Thank you everybody for logging in, for joining us on this webinar. We are here for the Health in our Watershed Boundary Region, and I speak a little bit about the boundary region for some of those. I know we've got a couple of people outside of our area. So I also hear that we've got a group coming in from Rock Creek, and they're viewing this at the Riverside Centers. Thank you very much, CL, for making that happen. If there's anybody else that is hosting this webinar in other locations that are having more people tying into the webinar, if you just let us know. It's always interesting to find out how many people are joining in and really also where people are from and some of that information for the group. So as we begin here today, I want to acknowledge the First Nations and Indigenous influence on the boundary region, the First Nation traditional history here in our boundary watersheds. And we have the boundary right there. I respectfully appreciate that the land on which many of us gather on and is referenced in this webinar is the converging traditional and unceded territory of the Syilx, Secwepemc, Sinixt people, as well as the Métis people who have also touched these lands. We are grateful to have this collective opportunity to share our knowledge and information via this webinar, both from our presenters and our attendees. So we'll certainly go into different ways of helping making sure that this is a conversation. So really keen on having some of that input and some of the experiences that everybody is having and some of the insights that people can bring to this topic. I think about this topic a lot. It's the connectivity of really everything in the watershed and how it all ties together. And I know as things get busy, mishaps happen, economic constraints, recovering from disasters, which is a big part of what so many of us have had to deal with here in the boundary. It can be easy to forget the connectivity between us, the health of our communities, and the watershed. How do we know the connectivity? How do we see it? And I'm just so excited to have Katie and Tara here, local representatives from the Interior Health, joining us today. They both work out of the Nelson office, so the big pink building downtown for any of those Nelsonites around. But I'm gonna take a stab that you probably are working a little bit from home lately, and as we deal with the COVID and you know, it's certainly something that has really touched everybody across the world. I did provide a little bit of a bio on both Katie and Tara, so thank you very much for providing that to me. I'll just give a quick rundown. Katie Hunter is Community Health Facilitator working with Interior Health. So now I call it Interior Health Authority. Is it does it make a difference?
So it is just Interior Health now, but the legal name is Interior Health Authority. So that's why on some documents you'll see Interior Health.
Ah, okay, because I started noticing and I remember thinking that I needed to check in with that. So great, with Interior Health, and works with the Healthy Community program. Has worked for Interior Health for 5 years, and in this position as a community health facility for the past 3. Katie works both with local governments and communities, so central Kootenay, but really, well, where our interest here is the regional district of the Kootenay boundary, developing public policies that create healthy and social built environments, including bringing population health and the equity lens to local government planning processes and actions. And I'm pretty excited I know that you're going to be touching a little bit on some of the reports and some of the plans that are happening throughout, just within regional districts. So that's really tying in how that interior health lens is included in some of those. Tara Stark is public health dietitian, also at Interior Health, Healthy Communities program. And from what I remember, you've been with Interior Health for 13 years and with the Healthy Communities for the full 5 years as the program has operated. Is that right? So that's, I'm keen to hear a little bit more about the program. It sounds like it's been a pretty neat start, and in addition to the area. So Tara works collectively with local governments, us, and community partners in the Central Kootenay and Kootenay boundary to create policy environments that support healthy eating and community food security. And I know that the food security part has been a big one for us in the boundary region, especially through the COVID, as everything was happening, the fall, the spring, trying to understand what was happening. How do we get the food out to the people that want it? How do the people that are hoping to be able to collect the food continue that process? So it's been, food security has been a big one that I know has come up a lot. So for myself, Christina Anderson, Watershed Planner for the Regional District of Kootenay Boundary. I've been in this position and here in the Grand Forks area for just over a year now. And I just wanted to quickly say a big thank you for all the boundary folks that have really helped me understand so many of the complexities and what's happening within our region, agriculture and forestry, the food security, social, economic concerns. It's just been, I really appreciate it. I know I have a lot to learn, and so thank you. The RDKB goal for these types of webinars is to just keep exploring our boundary watersheds, sharing information and learning. So this webinar is going to be broken down into 2 stages. Tara and Katie are going to be sharing us with their knowledge of health here in the boundary watershed and their tie-in with the local governments. I'm going to speak a little bit on past presentations and really try to tie in that connectivity of health to what we've heard in some of these presentations. I've got a couple of slides on some of the work, watershed work that's happened tied with human health, if we have some time at the end of the presentation. So a few quick housekeeping rules for today's webinar. This webinar is being recorded, and I just quickly checked to make sure that was the case. If you'd like a copy of the webinar, please go to the kettleriver.ca website. So I'm circling it here. Do you see it I'm going to look over at Katie and Tara, circling, perfect, on the left-hand side of the screen. So this is the Boundary Integrated Watershed Service website. It's the service that my position is based under. And so that's, give me a couple days before I get the recording up. But that's where we're certainly putting in any of the recordings of our past webinars. And so you're gonna hear a little bit about some of the stuff that we've had happen over the last couple months. And those are also present on that website. You are also welcome to send me an email, watershedplanner@rdkb.com, over on the right-hand side of that webinar, or sorry, that page, and if you want to have a link to the recording. Attendees are going to be muted. There's a variety of different ways to really help engage. We're really keen on hearing. Like one of the biggest things that you're going to hear through this presentation is it's that sharing of knowledge and transfer of information and building off other people's opinions and ideas. So I really encourage people to try to bring in some of those questions, comment on, hey, that maybe this is what we also saw in this region, and we're able to tie it to some of our boundary watersheds. So how do you do that? So quite a few of you have been using the chat box, which is great. So we're going to sort of say with the chat box, some of that introductions will be great for the chat box. Any type of webinar concerns, I can't hear, or there's a lot of background noise. Just seeing if you can please clarify this one specific point. That would be great for the chat box. Q&A, this is a great tool with the Zoom webinars. It's going to be coming up as a box. You can write your question in there. If it's something that I can address through the presentation, then I will while Katie and Tara are speaking. But I suspect we're probably going to leave most of it for Katie and Tara, and then we can discuss it at the end of the presentation. And raise hand. So one of the things that we did notice is that if you are coming in by phone, and I'm just going to see, I don't know, are you able to see if anyone's come in on the phone, Katie or Tara?
It looks like there's one phone number there.
We do have one phone number there. So, so if you are coming in by the phone, I'm not able to unmute you, unfortunately. So that was one of the things that I did notice. If you want to give me an email, and so I'm just going to, there we go, email, bottom right-hand corner, watershedplanner@rdkb.com. I can send you the presentations that are going to be posted throughout this presentation. So just letting you know on that one. And that was one of the ones that I wanted to try to make sure I didn't forget. So yeah, to start off, I'm just going to give a couple quick polls. So again, one of the neat options of these webinars is finding out where people are from and having some polls. Being able to find out, you know, where are having some of that engagement and that interaction. Oh, this is great. So I haven't ever done the poll with 2 questions at the same time, but I see that people are able to respond to both. So that's fantastic. We've got 10, we're just gonna, 55% have voted. And so we're just gonna, just another 10 more seconds and then I'll end the poll. So this is, I think this has been a pretty neat one for me on understanding what we have, who we have here. Oh, you guys, this is super. Okay, I'm gonna end the poll. So we have 40% of people from the boundary. Most of them are coming in from Area D, so it's directly to the Grand Forks area. And oh, sorry about that. I could have shared results. Sorry about that. And then we have somebody coming in from Area C and Midway, and I do believe the Area E, so that could be CL, and I know that there's a couple of people that are in the Rock Creek there. And so the other quick poll, if you don't mind, is how did you hear about this webinar? And I ask this question largely because we're really trying to understand how are we getting this information out? We're going to speak at the very end of the webinar. Just, you know, if you come up with ideas of different topics that you really would like to see discussed or focused on for the Boundary region, please email me. I'm pretty keen on trying to get some of this information out and the connectivity and the science out for people. So it would be, yeah, I'm really keen on having that information. Okay, I'm gonna just end the poll here. And so email is definitely the most common way that people heard about it. All right, stop sharing. So I will pass, thank you very much for that. And I'm gonna pass this over to Tara and Katie.
Perfect, thanks so much. I'll just get my slides up for everyone. Okay, just want to confirm everyone can see those slides. Yes. Okay. Thanks so much, Christina, for that introduction. We're just so happy to be invited here today to talk about the ways in which our health and the health of our community is impacted by our watershed. But we just want to start out by saying we're not watershed experts. Our expertise really is around health and health planning. And this is actually our first time specifically talking about watershed health. but we're hoping we can shed some light on a few examples of how watershed events might influence our health in ways that you might not have considered before. So we also wanted to do a bit of a territorial acknowledgement. Like Christina said, Tara and I are presenting from Nelson, so we'd like to acknowledge the traditional, ancestral, and unceded territories of the Ktunaxa, Sinixt, and Silks people, on which we are presenting from today, as well as the Secwepemc and Silks people whose watershed we are discussing. We also wanted to recognize the Métis Nation and their important role in shaping our current understanding of Indigenous ways of being and knowing. We also have a poll question, so Christina, if you could launch this one for us. Just a question to get everyone's brain warmed up. Perfect. Ooh, it looks like I can submit an answer. I'm going to.
Hey, I think you're cheating. Okay, we've got 6 people that have voted out of. Oh.
Just take a guess. Don't worry if you're wrong. I'm going to give you the answer.
Pretty close, 12 out of 17. 14 out of 17.
If you don't want to guess, just click other.
All right, and we're closing it. Here we go.
Okay, perfect. I'm going to build some suspense, and I'm not going to tell you who's right yet, but maybe as a teaser, the majority of the people are on the right track. So before I tell you the answer, I just want to run through a story asking a series of questions that helps to demonstrate all the factors that influence our health. So here on your slide, you see Jason, and Jason is in the hospital. But why is Jason in the hospital? Well, because he has a bad infection on his leg. But why does he have an infection on his leg? Well, he got a cut on his leg and it got infected. But why does he have a cut on his leg? Well, Jason was playing in the junkyard next to his apartment building and fell on a sharp piece of steel while he was playing there. But why was Jason playing in the junkyard? Well, because he lives in a neighborhood without access to green spaces or playgrounds, and a lot of kids play in the junkyard, and there's actually no one there to supervise them. Well, why does he live in that neighborhood? Well, his parents can't afford to live somewhere else. And you might ask, well, why can't his parents afford to live somewhere else? Well, they both are working shift work in minimum wage jobs right now. And why can't they get higher paying jobs? Well, because they aren't able to get the additional childcare for Jason to allow them to upgrade their education and skills through night school. But why? So as you can see, the more questions you ask about someone's health can really help you to understand the bigger picture and the context in which they live, which influences their health. So our health really is influenced by diverse factors, not only by our behavior, but also by the context in which we live, like our access to healthy food, transportation options, our income, education level, housing, and social networks, as well as our access to the natural environment, all play a role in determining our health. In our world, we call these factors the determinants of health. And when you consider the factors in our environments, like our water and air quality, our community infrastructure, which you see at the top of this pyramid in orange, as well as the factors in our life, like our access to education, our income, our housing, which you see at the bottom of the pyramid in pink, we can see that these contribute greatly to our health and together add up to about 60% of what influences our health. And this is compared to our genetics, our biology in purple there, which only contributes about to 15%, and our healthcare system, which you see in green, at only about 25%. So going back to the poll question, if you chose option 6, which was D and E, you are correct. So together, our built, natural, social, and economic environments have the largest impact on our health. So our Healthy Communities team really focuses on that 60%. We work with local governments and communities to support and influence policies that build healthy, natural, built, and social environments, like Christina mentioned in both our bios for Tara and I. And this really includes working on planning and policy projects that shape the way our community exists today and how they grow into the future. So this could be plans like an official community plan or a watershed plan. So now I'm going to pass it over to Tara to speak a little bit more specifically about each of the determinants.
Great, thanks. Just going to confirm you can hear me.
Yes.
Okay. So for the purpose of having a framework, we needed a framework to discuss the watershed and its links to health. We adapted a framework that was used by the provincial government. So here you see it on the screen. So this framework is used by the Ministry of Environment and Climate Change Strategy, and they use it to look at climate change hazards and the impact on the health determinants and health outcomes. The framework classifies impacts into 4 determinants of health: the natural environment, the built environment, community and social factors, and economic factors. And so basically what we're going to do is we're going to discuss each of the determinants in the context of watershed health and look at how the watershed events can impact human health. Okay, next slide, please. So the first determinant of health that we're going to look at more closely is the natural environment. So basically, we want to look at, if watershed impacts affect the natural environment, if riparian areas are flooded, if drought limits the amount of water available, how does that impact human health? So the impacts of extreme watershed events like flood or drought on the natural environment affect the aquatic life, affects the riparian areas, and it also affects the adjacent lands. And all of these impacts have impacts on human health. So the most direct health impact is the impact on our drinking water. So during a flood, there's an increased risk that drinking water can become contaminated with bacteria or any other contaminants that may be present in the floodwater. Another big impact is on adjacent land, and often adjacent lands are farmlands. And when farmers' crops get ruined by flood, or if farmers' crops are severely limited by drought, we see, their livelihood obviously is threatened, and then the community also misses out on all of their good, fresh, locally produced food. And we know that nutritious food supports health. So another impact that we see is the loss of the watershed for recreation use and for traditional and ceremonial uses by Indigenous people. So I'm going to talk about this one a bit more when we look at the third determinant of health. It's called social and cultural factors. But basically, extreme high water levels and extreme low water events have impacts on traditional and cultural uses of the watershed, as well as recreational uses of the watershed. So we know that river recreation is unsafe when the water is high. Fishing is impacted at both extreme high and low events, as is the ability to boat and tube. And these impacts, they impact our physical activity levels. They also impact the way we socialize, the way we connect around our watershed, and ultimately they impact our mental health. So you'll see that Katie and I drew a lot of images from the flooding, the big flood event of 2018. We just felt that they're such dramatic images. It helps us to make the connections between these sort of extreme events and health. So you'll see them a lot in our presentation. And by looking at these images, it's easy to understand how clean drinking water is threatened by flooding. But of course, a flood event can be much less severe than this and still impact drinking water. Harmonious relationships with our natural environment are also important for human health. We have health evidence that spending time in green environments contributes to positive mental and physical health outcomes. So, when people are unable to recreate safely in the watershed, it takes a toll on social connectedness and on mental health. What we want is a watershed that supplies adequate and safe water for all users, and that supports a healthy riparian area and aquatic life for a thriving ecosystem for all to enjoy.
So the next determinant we wanted to talk about was the built environment. So this includes everything in our community that is created by humans and for humans. So this includes all community infrastructure, roadways, sidewalks, playgrounds, housing, and then even things like our sewer and drinking water systems. So taking a look at extreme watershed events like flooding or drought, you can imagine the impacts that these events will have on our built environment and can have on our built environment. So first, damage to homes and businesses, and then damage to some of those community infrastructure pieces like roadways, sidewalks, pipes, water systems, etc., like I just mentioned. So in the short term, this damage can result in injuries or infectious disease transmission from contaminated drinking water, for example, as well as immediate mental health impacts from the stress, but also mental health impacts from the isolation that might occur if you're not able to access services or social networks in your community because of the damage. You can think of how shut down or blocked roadways might impact how you move about your community. And in the long term, this type of stress can lead to chronic conditions. So again, with some 2018 flooding examples, the impacts to housing and roadways were very clear, and then how that impacted things like the ability to transport essential goods like food to the grocery store. From these images, you can also imagine how a flooding event might overwhelm or impact the drinking water system in our community and our ability to have safe drinking water, which we've mentioned quite a few times. So ideally, our built environment allows for a community that is well connected and includes spaces with a diversity of uses like playgrounds, housing, retail space, and more. People of all ages and abilities should be able to gather, and the built environment can become a real key asset in building social connections.
So the third determinant that we're going to talk about is social and cultural factors. This determinant kind of has two parts. I'm going to speak to each of them independently. So the first part is closely tied with the natural environment determinant that I talked about earlier. So the way the community uses and socializes around, around the watershed is seriously impacted by extreme high and low water events. We lose recreation opportunities that we value, like fishing or tubing or swimming, boating. We also see an increase in injuries, especially associated with high water events. And then traditional and ceremonial uses of the watershed by Indigenous people can also be impacted. The second part of this determinant that I want to speak to is about the role of community social services and the impact on the community and social service sort of safety nets that are in place that exist to support people when they are in need. So, you know, what we see is that while communities will pull together in the short term to get through events like a flood or extreme drought or fire, the health impacts far outlast the event itself. So this can cause obviously extreme strain on people who are impacted. And then it also stretches the community resources that are in place. So community resources that are put in place to support people who are affected by adverse events. So I'm talking about things like mental health services, food banks, soup kitchens, places where people turn when they're experiencing great need and extreme stress. And actually, the Boundary Community Food Bank has a great stat on their website that states that the number of people who access their food bank increased by 30% from 2018 to 2019. That's a far greater jump than you ever see over a year period. So the watershed's an integral part of our social fabric. It's central to many of our recreation activities, and we want to be able to enjoy it year round.
So the last determinant we're going to touch on today is the economic factors that may be impacted by watershed and thereby influencing our health. So we know that extreme watersheds events have significant costs and that our health and income are tightly linked. So costs of repairs or disruptions to supply chains, loss of job opportunities or community economic development opportunities can all result out of extreme watershed events. For example, flooding or drought could result in immense costs for a farmer, threatening their livelihood, like Tara has spoken to, but also result in job loss for the community and economic development opportunities for the community for those who might have been relying on farm products for their own business. In the short term, it can result in an inability to afford basic needs like healthy food, medication, rent, all which can lead to stress and to miss community connections. And in the long term, living under these financial constraints can really lead to an exacerbation of chronic conditions. So again, from the 2018 flood, the impacts to the business community were very clear. And we know how these impacts rippled throughout the community with losses of jobs, losses of places of key community connection, as well as growing debt for business owners. You can see in this article at the top of the screen that many business owners were forced to juggle credit cards or dip into different savings funds just to cover the costs of the flooding. So we also know from some stats from the Red Cross from the 2018 floods that show that in the first 6 months after flooding, 437 households in the boundary received financial assistance to cover their basic needs like food, utilities, medication, or housing. And then an additional 318 referrals were made to mental health and well-being supports in the area. We see that when communities are able to develop vibrant local economies, there can be increased opportunities for community connections, improved quality of life, and improved health of the community overall.
So we're going to move in to sort of the second part of our presentation now, where we just want to talk a little bit about our Healthy Communities team and also just the links that we see for watershed planning and how health and watershed planning are linked. So I'm going to speak to these two documents that are on the screen, but first I thought I'd just tell you a bit more about how our Healthy Community team works. So the Healthy Communities team is a little team in interior health. So I work a small position, I'm at 0.6, and the Healthy Communities work I do is only a small piece of that job, and I cover the Kootenay and the boundary. So just to give you an idea, we're not, we're a relatively small team. But we have general community health facilitators like Katie, who does work full-time and full-time on Healthy Communities. And Katie works with local governments on a variety of health-related issues. So Katie will work on things like housing and poverty. She'll work on built environment, like roadway connections, trail networks, things like that, that impact community health. And then on our team, we also have specialists in tobacco and vaping regulation. And we have me, who works in food and agriculture, nutrition and agriculture. So often in Healthy Communities work, our role of our team is to bring the health evidence to the table. And this is often a planning table. And so with respect to watershed health as it relates to human health, ideally, we would see actions to protect the watershed embedded in community planning processes. And I'll be curious to hear what Christina thinks after this. Because like we said, we haven't worked a lot in watershed. But one example I thought I would speak to is I recently worked with the Boundary Area Food and Agriculture Advisory Council to create the Boundary Area Food and Agriculture Plan. And so working on this plan, there were really vocal and knowledgeable watershed stewards who were at the table. And one of the 8 goals that ended up in the plan is to steward the connections between environmental sustainability and the regional food and agriculture system. And so this goal includes objectives and actions that are related to managing water resources. And these are actions like including and considering agricultural needs in drought, flooding, groundwater, and management plans, to promote and implement best management, irrigation, and water conservation on farms. So really specific actions related to water and the watershed. And I just wanted to share that this was a great learning experience for me, because there was such broad representation at this planning table, looking to create the food and agriculture plan. And, you know, I learned so much from the water stewards, and it ended up being an important part of the plan. And I think, you know, we truly need people with all different areas of expertise and knowledge and passion to participate in community planning processes to get the best results. So that was my personal example there. And the other document you see on the slide is the Midway Official Community Plan. And so an official community plan sets the long-term vision and policies for growth in a community. And in this one, I think Katie did work with Midway on this plan. And the Village of Midway included some language. And their language, I think it says, I have it here, actively plan and advocate on behalf of our watershed. So this is part of their community vision. So plans like this can also include watershed language, and I think it's really important that watershed work is integrated into all of the planning work that we do.
Yeah, thanks, Sarah. Maybe just to add on that Midway example too, for people who aren't familiar with an OCP, by having that in the community vision, there is then trickle down, or that vision then gets spread through policies and bylaws that shape the way the community grows. So it's more than just a visionary statement, it then gets implemented into actions the community takes to use the space they're in. An opportunity that may be upcoming is related to the RDKB Housing Needs Report. So the findings from this report are going to be released shortly, I believe. And this will speak to the housing supply and demand in the region. So some questions I've been thinking about since pulling together this presentation, and questions I can commit to bringing forward as I'm involved in the different planning processes that are based on the findings of this report, might be, where do we plan developments for new housing stock, and how is that impacting the watershed? Or with a bit of an equity lens, how many community members are living in areas that are vulnerable to watershed changes currently? So just to summarize, everything we've gone through today, if you can only remember 3 key points, these are them. Our health is influenced by a variety of factors, including the environments in which we live and the context in which we live our lives. Adverse watershed events can impact our health and the health of our communities. And watershed management and planning can protect our natural and built environments, as well as support community connections and our local economies, which will ultimately result in healthier communities. And that's all we have. So we have probably lots of time for questions if there is any.
That's fantastic. Thank you very much. So I don't have any questions here. I'm just looking at the Q&A box. Nope, we're still good. So I have a question. Tara, Have you, so in terms of working with, say, agriculture or food security, have you noticed a change of concern with food security? And through maybe the conversations with the community members, or, obviously specifically, whether it's changes throughout the province, and I'll let you speak.
So, I mean, the COVID crisis has really shed a light on, I think, how vulnerable our food chains are. And I don't know if that's what you were referring to, Christina, or if you wanted me to speak more to watershed impacts, but I do see there is a lot of change happening in community engagement around food issues, and local government interest in getting involved in food issues and understanding them more clearly. And I think there's generally people are seeing the value in food self-sufficiency more now than they ever have before. So, like, yeah, we're seeing more interest from local government around things like food charters, or, task forces to talk about our vulnerabilities as communities who rely mostly on imported food.
Wow.
Yeah, I don't know if that answered your question. And then there are also issues of food insecurity. So when people are losing, potentially losing their jobs or going through periods of unemployment, then it's similar to like those adverse watershed events. Whenever we have adverse community events, there's more pressure on the systems that support people who are in crisis. So, like you mentioned, I think in your intro, just lots of pressure on like soup kitchens and food banks to figure out how to do things differently and safely.
Yeah, the whole COVID, who would have thought that we'd be in a global pandemic? The COVID situation has been certainly changed. Do you find that, so the food security, I guess, is both distribution that you're seeing in terms of the COVID side, distribution, as well as actually getting the food, and people having enough food to be able to deal with the fact, especially if they couldn't get the international imports coming into their area?
Yeah, I mean, I don't think we've seen that happen. We haven't really seen that impact. What we've seen is the impact of people hoarding, right? We kind of saw some empty shelves at the beginning of the pandemic. And that's a stressful event for people, to go to the grocery store and not be able to get the toilet paper that you want to have. And yes, definitely, I think community service agencies figuring out how to function. Sorry, I may have been lost the thread of the question.
I think another impact that was a COVID-related impact was farm workers, and the concern around how do we keep farm workers safe.
Okay.
And recognizing that a lot of farm workers come from out of the country and maybe weren't coming. How do we get our products from the farm to consumers as well? That was a big conversation through the spring.
Mm-hmm. Yeah, and sorry, I jumped right to COVID because that is just like my world right now, when it comes to food systems, work and emergency food. That's what's really motivating, I think. A lot of people are extremely interested and concerned.
Yeah, I guess, and so, I think a lot of us are jumping right to COVID. It's, this could have been an in-person presentation if we weren't dealing with COVID at the moment. So it's certainly a big part of everybody's lives right now. I think the other question sort of was tying to that bigger picture. Like, have we noticed a change with some of those community conversations over, say, the last 10 years or 5 years, in terms of, you're talking, or maybe everything is just sped up now with COVID. I don't know whether climate change has come into conversations and people are starting to notice that, or people are starting to think. Do you find that there's more engagement to this conversation, or people are retreating a bit more, or that you're having more movement? I think one of the things that I've found through some of my research is the more people stay in one place, the more they sometimes are able to really get to know that watershed and understand sort of, I guess, maybe some of the adaptation components of it. I don't know, climate change, movement.
Yeah, I can speak to that because I've been doing a lot of climate change work because I think it is becoming so top of mind, also as like the key lens in which a lot of local governments are framing all their planning. And I've been noticing even in the past year, and this could be like a bit of my own bias because I'm understanding it better, but it feels like local governments, elected officials, staff, and community members are better understanding the interactions between, I'm just looking at the chat box too, and Ciel's just saying exactly what I want to say. Those extreme climate events like wildfire, flooding, and how that impacts community health. They're understanding the long-term climate change impacts and how that's linked to community health, as well as, which I'm seeing as a win because it helps me get some buy-in from different audiences, is how that local economy piece fits with climate change and fits with a healthy community. So I'm just seeing like, yeah, just much better understanding of all those overlaps and understanding that, I guess it's like breaking down the silos. Like we can have, well, my biased opinion, it's the healthy community lens that overarches all these key community concerns and priorities. And the healthy community lens, I feel, is so similar to the climate change lens. So yeah, it feels very hopeful for me.
That's, yeah, and yeah, thank you. I know it's something that, and of course, I'm sort of somewhat caught on that too. I'm it's in so much of my schooling and my work, looking at that component of the climate change and the changing. So sometimes I wonder whether it's my own bias that I think it's becoming a bit more of a topic, or whether it is coming out into those discussions. So that's always what is interesting to find out what people are getting from the communities. I think maybe I'd put it out to our attendees, the people that are listening to this webinar. Do you feel that it is becoming, do you feel like there's a change in that discussion, a change in maybe breaking down the silos of the different groups and people trying to come together to come up with a bit more of an idea of how to deal with some of these problems? And sort of a bit of an open-ended question there. We do have a question in our question Q&A box. Thank you very much, Kathy. Can you speak to the importance of selecting logging practices to turbidity in runoff and the economic costs associated with providing potable water in cases of high turbidity given the increased risk of contamination? So,
no, we can't.
Okay.
Yeah.
I don't know whether you can you read the Q&A?
I could open it up, but what I can, here, 1 second, sorry, let me just, Kathy, I'll get your question up here so I can.
And I can speak to a little bit of it too.
Yeah, so I know that this is conversations that I have heard so we have a drinking water specialty team in Interior Health that kind of works outside of our Healthy Communities team, but I'll interact with them on different projects. So drinking water and large water systems team, and that's all the environmental health officers that really specialize in this work. And I know these are conversations they have in community with their different drinking water system providers. So I can't speak to it, but I see how this, especially in our rural areas, when I'm doing planning work, how this is a key community priority that needs to be given some time to discuss.
And I think, you know, and I'm going to be touching a little bit on this in some of the information that I'll be presenting just afterwards here, in terms of some of the webinars and some of the research that's happened. There's a pretty neat case study that I'll look into. But I think, you know, and that's a good point. Maybe this is something, you know, people think that this is a topic that we really need to start focusing in on in terms of doing a focused webinar on just that drinking water component of the changing climate and turbidity. I know that increased sedimentation, it does make filtration significantly more expensive and causing that risk to pathogens. So I certainly understand the concern around that, and whether or not it's tied to logging practices, erosion, and certainly probably the cumulative effects, the accumulation of a variety of the different components. But certainly, you know, that question ties in so many different characteristics, the economic, the social, the mental health of knowing what the potential problems are, tying what's happening there, and for sure that big picture of the watershed protection.
Mm-hmm.
I'll touch a little bit on it, Kathy, as we go through the questions on it, but I think it's probably going to one that we'll have to table to try to have a bit more of a focused conversation on in terms of just that drinking water risk. Are there any other questions out for the group, or is there anything else that, that you, I just dropped the screen, sorry, that you're wanting to provide and share? But thank you very much. This was a great, and I think the biggest part that one of the components, and thank you for your 3 points, is really that connectivity of so many different groups. One of the comments that I've noticed is, sorry, I'm just gonna share my screen for a second here.
Oh yeah, here, I'll stop sharing.
And I moved over to, a different slide than what I was expecting to present right now. And mainly because one of the things that Katie said as she started is, you know, we're not experts. We're not watershed experts. I think this whole conversation, and for those of you that are familiar with the term eco-health, which is an interdisciplinary research tying in watershed protection, health, human health, and society health. It's really the whole point of this is everything is, so many different groups are coming together. Katie made a good point of you know, trying to break down through the silos, trying to really understand that there's so many different components of this conversation that are necessary in order to be able to hopefully come up with a solution in the big picture of why, of moving forward. The reason I wanted to just quickly tie in this paper, it is from 2010, it's a bit old, but I wanted to sort of tie in Department of Geography, and unfortunately we don't have Dr. Ogborn's department together within the paper, Health Sciences and Earth Sciences. Collectively, this is something that we're seeing a lot more. It's that interdisciplinary practice, and this is why I really appreciate Katie and Tara presenting on this. Local representatives from the Interior Health region really out there being able to speak to some of that community component of it. One of the other parts that I really liked about this paper, you know, obviously speaking to the information available, Diane Allen is your groundwater. She did a lot of the groundwater, surface water, groundwater interaction work here in the Grand Forks area and in the Boundary region. I know that she has spoken to the folks in the Fife community. We've certainly done some work up in the West Boundary. So really seeing, you know, you've got somebody that is focused on that watershed and now branching out to some of the health components, starting to realize that we have to look in that big picture, and we have to be able to, so we're just presenting our section of information, but knowing that how both what we present affects so many other people, as well as we have to be able to listen to the other components. The couple points that I really liked about this paper, health threats to climate change are location specific. So the comments, you know, what's going to be happening up in northern BC and the far north of Canada isn't necessarily going to be the same adverse effects that might be happening in the Okanagan and the Boundary region. and that their factors are facing concurrent environmental and socioeconomic stress. So it's also really tying into what is the vulnerability of the populations for that area. So one of the things that I've really been hearing a lot about is it's one thing if somebody is recovering from one disaster. If you happen to have had, let's say, which is what the boundary has experienced, 3 floods in the last 4 years, we are, it's just disaster after disaster after disaster. And it's that exhaustion, that recovery capability. Katie spoke about the housing, where do we find the good housing? Where do we put in some proper housing? So much of that is, tied to that food security conversation that Tara was talking about. And, can we put that together? Can we do some ways to limit some of the travel? Can we sort of tie some of this together, and does it make sense? So, we certainly spoke a lot about the physical changes that are tied with climate change, greater exposure to fire and flood, increased exposure to heat and air pollution. It changes between cities and some of those developed areas versus the rural areas. One of the comments that I quickly made was just that shift of what happens when somebody has known, they've had generations and generations in a watershed. It both provides them that capability of being able to really secure their understanding of, see the changes, how maybe what changes they can do, or their actions, how their actions are affecting downstream or affecting the health and the health of their communities. Harder if you have a transient communities, transient environments where you don't have that continuity of space and understanding. And the other one that I know that was also touched on is just the strain on our healthcare system. So, as we certainly have the disasters and we have some of those pressures, it really does put a pretty intense strain on a lot of the healthcare. Kelowna fires in 2003, you had an increase from 46 to 78% of physician visits due to respiratory concerns. The potential pollution concerns, as we spoke a little bit about that, the flooding, could be E. coli, could be hydrocarbons. A lot of the time we don't necessarily know. So it's some of that pre-planning. And I think that's where these conversations are really important, to be able to understand why, what are some of the components that we're needing to keep into consideration as we do some of that proactive work, and really sometimes ask the questions or sign up for some of the community reviews that are happening. I know that the OCP reviews happen on a regular basis. Well, regular basis, they happen every 10 years. My my RDKB staff are going to be talking to me about that. So yeah, maybe getting more involved, and just exactly what Katie was saying, having that added perspective, and being able to share your voice, the Indigenous voice, the transient, people that are knowledgeable and present in that landscape. So I just wanted to quickly touch in on that, just because I think the eco-health and that interdisciplinary component is I think a really important part of understanding the big picture. I know that I personally have done a bit of international water monitoring and water quality work in developing countries, international countries, and I really see firsthand that tie-in between that health component, drinking water. Kathy spoke a little bit about the turbidity concerns, so that erosion, and how that directly affects health and availability to be living in certain areas. But back to the boundary area. So I just wanted to, pretty excited about the topic. So I really wanted to sort of tie in some of these presentations. So what we're seeing here, and I just want to confirm that you've got the previous RDKB Watershed webinar. That's what you're seeing on your screen. Thank you. So we've had 3 RDKB Watershed webinar presentations since I've started this position. The first one was in December 2019, and as you can see, it was an in-person presentation. So that's something that we haven't been able to do since, and it was interesting seeing the picture. And yeah, it was, how fast things can change. You know, when things have to change, you know, people getting used to being exposed to some of these webinars, and it becoming now trying to understand how to make the availability and how to make that happen for you and your community, rather than is it even possible for it to happen. So I think there's been a pretty neat, a very interesting shift. We certainly wouldn't want to have had this happen, and I think it's sort of understanding how are we working with what we've got in terms of the COVID situation. Our first presentation was on groundwater and aquifer information. So again, I spoke a little bit about Diane Allen, who has done a fairly substantial amount of research in the boundary region on that surface water groundwater interaction. Really understanding, looking at the water cycle, you know, that rain to falling on the surface, going into the ground, talking about confined and unconfined aquifers, and moving back out to the surface as base flow. We heard from PCIC, Pacific Climate Impact Consortium. What's climate change got to do with it? They were really talking to us about some of the different tools that are used, and being able to understand how do we find out some of the proposed changes within the boundary region. We heard from Forest Lands, Natural Resource Operations, and Rural Development on the bioclimatic ecosystem classification for the boundary region. This was a very interesting presentation. So first, talking about how the ecosystem classification is presented, and we have it's both plant associations as well as the geos. So looking at the topography, geology, and slope. It's something that we'll talk a little bit about as I give you just some of the highlights from the presentations. So one of the things that I will say is, if Katie and Tara want to jump in, if you're sort of like, oh yeah, hey, this is another health component that would be tied into some of what you're talking about. Certainly I welcome it. So we spoke a little bit about Instructor Lutz speaking to us about the movement of water. The comment had been, how do we, one of the things that we hear rather often is, I'm getting my water from a groundwater source. So it's okay, I'm safe, and this is the concerns, the watershed protection concerns are just affecting at that top level. What Diane Allen, and through a lot of her work did, and some of a lot of the research being done by Mike Way through the boundary region, was just showing the effects of an unconfined aquifer, how what happens on the surface also goes in. So that's what's happening with this. Any of my provincial government staff that might be on this webinar, you're going to recognize the Envision 3000 model. So it's looking at, you know, what you do on the surface, how does that move through to your lakes? It changes based off, are we in a drought? Do we have not a lot of water moving through? So so the water will be quite slow as it passes through working with gravity, or are we in a big rain event? So the water is moving very, very fast, much faster through to the different sources, the surface water sources. It could be a lake, it could be somebody else as well. So knowing that it's all connected, what is happening in the surface part is coming through. So it's going to be coming through to, say, your lakes. We spoke a little bit about flooding, potential for E. coli or hydrocarbons. It moves through the lakes. It could be on overland flow, and it can be moving through the ground through different substrates. So really important to understand some of your different substrates. Here we go. The next presentation was really looking at the climate change. It was a really neat tool to be able to understand, you know, how can we figure out some of the different climate change options for the boundary region. So one of the things that we do notice is, and we hear quite often, is that future warming of BC. So as a general, we've been noticing the warming. We've been reporting the warming on a global level. Certainly BC has been seeing the warming at the scientific statistical analysis level. One of the things we found for the boundary region is an increase in spring minimum temperature. And so this is a nighttime low temperature. So you're seeing that the lighter colors is that increase in temperature rating. We spoke a little bit about extreme events. That was one of the things that they brought up quite a bit. You're going to see a lot more extreme events happening. So those higher flows, it could be more of the drought. So when we start looking at that, heat conditions, you know, we talked a little bit about all of a sudden trying to find enough water for that irrigation. So you may start finding it in terms of that economic component, you know, how does that affect the irrigator that is suddenly able to, that is worried about having enough water. So I know that in agriculture, and I don't know whether Tara can speak to some of the food securities tied to the drought, if there's anything to add on that, but understanding, you know, maybe it's changing some of those practices. Well, changing agricultural practices is a big economic component. So really being aware of all those factors, high flows, water quality, the mental and physical stress associated with dealing with the flows, trying to protect some of those homes and moving, having to relocate areas. So we did have PSIC did comment on more frequent and intense wet days as well for the boundary region. So you're seeing over here again in that boundary region, the Grand Forks, Greenwood, and Beaverdale area. Most of our precipitation is being shown to increase in the winter months, general annual increase, with less precipitation expected during the drier summer months. The bioclimatic ecosystem classification presentation that was just last month, that was put on by Colin Mahoney, who is a research climatologist scientist, and Deb McKillop, who is also out of the Pink Building in Nelson. She's a research ecologist, and she has been pretty much in the Kootenay region for most of her life. So she's very familiar with the area. She works focused right on the Kootenay boundary for the provincial government for the area. And so one of the things that Deb is speaking to is they're just updating their ecosystem, but their BEC mapping for the boundary region. This information, I just found really interesting. So we get all this information about climate change, and we keep hearing we're gonna have wetter periods as an annual, it's gonna be drier in the summer, we're gonna have an overall increase in temperature. What does it mean? And I was really excited to be able to have call and speak to a bit of that, the big picture. So here we have a reference map. So for anyone that does want some more explanation on what the different BEC zoning means into your Douglas fir, montane spruce, I recommend you go to the webinar, and you can hear all about it. But you can also just Google it. So what it's looking at, this is a reference map 1961 to 1990. And so we're seeing just a little bit of that red, so that bunch grass sort of. So we've got here, so there's got the West Kettle, there's your Christian Valley, over here is Grand Forks, and then we start coming into the Midway, the Rock Creek area in this section in here. And so most of the area is your pink and your dark purple, Ingerman spruce, and your montane spruce, so your higher elevation, higher mountain ecosystems. So remember, this is not just plants, this is also ties in your topography, your amount of water, the aspects, and obviously topography and aspect won't change with climate change. So it's going to be obviously the water and your plants. What does that mean? So as you can see, we have that change coming in. We've got an increase in bunch grass that's being projected for really, as we start moving through that 2041 to 2070. They always do it in a big normals range of 30 years. Bunch grass is a tougher one to be able to have tree establishment on it. And so understanding, what does that mean? How does that change the ecosystem? We spoke a little bit about animals and the movement of species at risk. What do we plant? Changes of food. So we talked a little bit about food security, the economic component. So one of the questions was on logging practices. How does that maybe change, or how does that tie into some of the watershed big picture, watershed health protection? We've done a cumulative effects report, or it's in the process of being worked on, and some hydrological analysis for the Kettle River watershed. I think the big point here to take home is, we are certainly seeing some changing, and with knowing that we have that changing of more of a drier environment in some of our areas, especially our low-lying areas right along the waterways, you know, what does that mean to fisheries and to cultural practices? Could be wild harvesting. How is that changing sort of for the food collection and the berry picking and availability for different species? So those were the 3 presentations that we had. And I will just quickly stop to say, because I see that there is a chat box. Is there any questions? Yeah, CL had said it means that we're going to be having less forests. Yeah, and thank you, Connie. Thanks for putting these pieces together, accumulating eventually in the big picture and how everybody's life is affected, adding to watershed conversations. I think this is it. Like, it's that interdisciplinary component of what we're all experiencing. So I will we only have a few minutes left. If there's any questions or anybody who needs any information from Tara or Katie, I'll give you just a second here. Otherwise, I'm kind of keen to just show you a pretty neat watershed project, not in Canada, that I was really excited about. I don't know, should I just continue through? I'm looking over at at Katie and Tara here. Perfect. Okay, I need to start off, and I'm not going to spend a lot of time on this. I really need to start off with saying that I am in no way an expert on the New York water supply system. I wanted to bring it to the attention of this group because I think it's a really nice look at tying in so many of these components of information that we're talking about today. It's obviously on a significantly larger scale. The New York City population is 8.4 million. That was based off 2018 numbers. And just for representation, Vancouver is for 2017 though, as 675. So it's 8% of the New York population. So we are working way outside of anything that the boundary is talking. But the reason I wanted to tie this in is the New York water supply system. They had a problem. They got to a stage where they had to decide: do we start really working, and totally with where that question came in, do we start working on filtration, the cost of filtration, the cost of treatment at the end point, or what happens if we just put all of our attention into preventative and prevent the contamination and prevent the concerns at the front end point, so the watershed protection stage. And so what they decided to do was give that a go, do the water protection, really intense water protection work, and to be able to hopefully keep some of that clean water coming through their system to require less filtration and less cost of processing at the point right before they give it out to the distribution to New York City. What you have here is Catskill Delaware watersheds. So it is mostly rural, very high in the agriculture and forestry. So the other part that I really wanted to show is that, like, these are very much working watersheds. You've got your dairy, vegetables, mixed livestock farms. They are working very closely with the landowners and to protect that water quality. In the far left here, Agricultural Council mission to address surface water quality through land conservation while supporting the economic viability of agriculture and forestry in the watershed region. And these are some of the uses: whole farm plans, forest management plans, and conservation easements. So some of the information: the Catskill Delaware watershed is 4,100 kilometers squared. Kettle Valley watershed is 9,800 kilometers squared, with 75% of that watershed in Canada. So sort of looking at the difference in terms of the size of it. They are now, so far, they are still being able to maintain most of their water is an unfiltered water, disinfected with UV and chlorine. but it is not having to go through that expensive filtering process. So we spoke a little bit of that turbidity comment that I know that was brought up in one of the questions. So now, in no way am I trying to say that we should do this in the Kettle River watershed, because this is for 9 million people. This is not what we need to do here. But what I wanted to be able to show, and this is a lot of damming, this is some pretty big reservoirs. What I wanted to be able to show is, that protection of that watershed, everybody working together, understanding that forestry is happening, agriculture is happening, tourism is happening, and how to shift some of that. And the only reason this worked is because you did have that interdisciplinary. People collectively decided at the end of the day, we need to try to meet what we need have in terms of our economic and our human health components, as well as our neighbors and those of our community. So they were able to spend $1.5 billion spent on water protection over 10 years. And this avoided a $6 billion in capital costs and $300 million in annual operating costs for a filtration system. So it's sort of one of those quick, point. And so this is just a little bit of information. Like I said, there's been a lot of research done on this project. I just would really encourage people to take a look at it. I know that for me, it was a bit of an eye-opener that something to this large scale was able to pull together and have those connections with the watershed owners and the private landowners, to be able to understand how do we all work together to be able to move towards this common goal. And this was sort of I liked the breakdown of it. They just put in this is a 2018 article, and they just put in a recent $1 billion to help this. Again, way outside of our, say, $15,000 that we might get periodically. But, $200 million to deal with the wastewater treatment plants. Their comment is we have to do this because that water goes back into the environment. So that is really important that we're looking at that big picture. $180 million towards reducing pollution from working farms and managing forests to increase nutrients absorption and hydrological function. It's something that so many people have been speaking about as well. I've certainly heard that fairly loud and clear, and it'd be interesting to see, how often some of that is coming up through some of those conversations. Shoring eroding streams, and then we spoke about that turbidity comment on it, to improve water quality and support flood mitigation projects. So it was, I think for me, obviously it's at an extremely different scale than what we're dealing with in the boundary, but I think for me it was pretty neat to see somebody looking at it and being able to try to focus on some of those components. So I actually didn't know that this was an action slide. That's pretty funny. So this is just a really neat bit of information that came in under the climate change and human health. I liked it because I just felt like it gave a bit of a nice overview. Now this is big picture. This was something that even the watershed, the New York City water supply system is concerned about. They're looking at that climate change, the changes of extreme events. And so they are very worried about that turbidity concern, because once you start having that increased erosion, then you start having the turbidity ties to the pathogens, ties to the economic, ties to the agriculture, ties to the human health component of things. So it's just sort of a variety of different areas. And it's, like I said, it's not specific to each area. It is it is specific to, your climate effect is specific to each area. And so what may be the effects in one spot is not necessarily the effects in the next spot. And this is from Center for Disease Control. So coming to the end, it's just the sharing knowledge, making plans and working together. I liked this cartoon. It two people that work really, really hard, and they made a great job, but they forgot to talk to each other. And so now they're both sort of stuck and looking at each other and trying to figure out how do we finally finish the project to get to the end result. And it looks like they may have to probably backtrack a little bit and pull some of this away so that they can end up building that connecting bridge. So it's, so much of it is sharing that knowledge and making sure that you are putting in that care, understanding how your actions affect the bigger picture and the bigger system, but also communicating that with others. And so much through the conversations that you're having, through the different reports and the plans, the agricultural community engagements, just being able to have those open conversations. And this is why we really appreciate so much to have those perspectives coming through. I think this is my last slide. It is. So on that note, I just wanted to thank everybody. If there's any questions, I'm certainly open for questions. I'd encourage everybody to take some time to take a look at some of the different big watershed projects that are happening out there. And knowing that there is so many different components to this, you know, human health, both the physical and the mental, the social economic structure of the communities, and how it all, you know, one action does affect and influence so many of the other components.
Thanks so much. Thanks for giving us the opportunity to join the conversation today.
Well, I really appreciate both of you tying in with this, and and I look forward to seeing the input on in the different plans. I know that we really appreciate having that interior health component of it, and shucks, especially in the time of COVID, we're trying to learn as much as we possibly can. And so thank you everybody for your input and for spending the time with us today. And I really look forward to hearing from people. If there is some topics and presentations that you'd like us to start focusing on, or, you know, a topic that you'd like me to maybe do some research on to try to find some presenters to speak to it, please let me know at watershedplanner@rdkb.com.
There's just a question or a comment in the chat box about staying in contact with, it says your team. So I don't know if it's, Christina, your watershed team or our Healthy Communities team, but if it's related to Healthy Communities, you can send an email to healthycommunities@interiorhealth.ca. I'll put it in the chat box, and you can be subscribed to our newsletter, which we send out all sorts of information, funding opportunities, webinars, etc. So I will just put that in the chat box right now.
Super, thank you. And in terms of some of the work that we're doing, I am trying to work at updating the Boundary Integrated Watershed Service Facebook page for some of the events that are coming through that are watershed related, and our website. I know the RDKB is in the process of updating their full RDKB website. And so once that happens, we'll be switching everything over to their system. But again, kettleriver.ca and my email address, watershedplanner@rdkb.com. So if there's nothing else, I'm just so excited about this conversation, and I know that this is just the beginning, and I will be working with both of you a fair bit as we come through. And I encourage people to, first off, just remembering those interconnections and the connectivity of the different groups, and bring in that information and try to get involved, and I don't know, how often do your food security and agriculture committees meet?
The boundary, I'm trying to remember when the Boundary Area Food and Agriculture Advisory Council last met. It's a mouthful. I honestly can't remember. So nothing has happened since COVID. Yeah. And I'm not sure what that will look like going forward. It's usually your department, to the regional district of Kootenay Boundary, that has been managing and organizing those, which has been amazing. I can't speak to it, I don't know.
Yeah, no, fair enough. It's yeah, and it'd be information on the RDKB website. So with that, I will sign off. Thank you very much, and have a good afternoon, everybody.
Thanks, everyone.
Bye.